Good morning. I'm Dr. Narayanan, a Siddha physician from the Center for Traditional Medicine Research, Chennai. We had a traditional food snack, that's chundal. Essentially, the pulses were baked and garnished, and this gave us an adequate energy and nutrition and was a good supplement to carbohydrates and fat. Very unfortunately, this preparation of sundal has also have taken a backseat in traditional households, even in India, not to talk about the non-resident Indians overseas. It will be shocking to know that if the incidence of diabetes is 17% among the Indians here, it's 40% among the non-resident Indians. For them, they have to think back of the fresh green leafy vegetables, which are also chosen based on the taste of them. Because our traditional science teaches us that our food is our medicine. The options are plenty, starting from brinjal, lady's finger, pumpkin, beans, the different types of beans, the cluster bean in particular, the different gourds, the bitter gourd, the snake gourd, the rich gourd, various vegetables we have. And if we take that in a cycle or rotation, we may not have it repeated within a period of 14 days. Very unfortunately, this has also given way and we have started liking more of tubers. Essentially, tubers are the one, including potatoes, are the ones which can contribute to the increased carbohydrate level or the sweet taste as it is classified by the traditional Siddha medicine, and which can aggravate or activate, precipitate the condition even in a potential diabetic. What we need to do further? There's always a question, should we be taking a lot of salads and fruits? Whether the fruits are allowed. Essentially, some of the fruits are not allowed. Particularly, they should not be taken in larger quantities. They are the bananas, the jackfruit, and the mangoes. These are the three of the best of the tropical fruits. If we are going to avoid that, what is the option that we have? This may be the question that everybody may be having in the mind. We can think of guava, we can think of papaya, we can think of apple, we can think of pomegranate, we can think even of the jamun fruit. These are the fruits which can be taken in moderation, and fruits like banana, jackfruit and mango, not more than 1 or 2 small servings, that too not regularly, once in a week maybe. Then, what are the spices? The spices that are very good, food supplements which are very good in controlling our blood sugar levels are turmeric, garlic, Indian gooseberry, fenugreek and curry leaves. Let me explain each one of them separately. Turmeric, as we all know, is the king of all spices of India because almost every food, every diet goes with haldi in it. Turmeric is not just a hypoglycemic agent which will bring down the blood sugar level, it's also a very good antioxidant and a free radical scavenger. Turmeric is essentially a hypocholestemic agent. Usually if you see, most of the diabetic, particularly the type 2 diabetes, the diabetes which occur after a particular age, the patients also suffer from obesity, hypercholesteremia. Turmeric is one spice which not just reduces the blood sugar level, it also reduces the serum cholesterol level, and it's also a liver corrective. We all know liver is the storehouse of all our energy, and this is where glycogenolysis takes place and new glucogenesis takes place. Therefore, essentially in the diabetes management, according to the traditional system of medicine, we need to have medicines which supports the liver, which will enhance or improve the pitta and thereby create a balance of the kapha. Then we have fenugreek. Fenugreek has got twin activities. One is the fiber, the mucilaginous part of fenugreek, which prevents absorptions of sugar from our intestine. Also, one of the problem of the diabetic patient is the constipation, which is prevented by the fibers which is present in fenugreek. Fenugreek also has got certain bitter compounds which essentially reduces the blood sugar level also. It acts on a twin basis. One is because of the fiber content, forms a bulk, prevents constipation and fastens the flow in the bowel, thereby prevent constipation and absorption into the intestinal pathway. And because of its bitter principle, it reduces the blood sugar level also. The role of curry leaf is very, very important, and not many of us give its due credit. We throw away when we take our food. Why? Curry leaf contains a compound which is similar to vitamin K or rutin. Rutin is essential to keep our small blood vessels in order. You know, the glucose in your blood is transferred to the cell through the small blood vessels, what we call as capillaries. When the capillaries get damaged because of the overload of sugar in the blood, it affects the cell. So curry leaf, its rooting is very important for sensitizing and keeping the small blood vessel in good position so that the transfer of sugar from the blood to the cell is proper and the capillary fragility does not lead to problem. Many of the problems, the complication of diabetes, like the injuries, non-healing wounds, like the diabetic foot, the impairment of vision, all these things could be prevented by the intake of a simple food ingredient called as curry leaf. Then we have two important ingredients in the conventional medicine that is used in diabetes by the Siddha physicians. One is the Phyllanthus amaris, the well-known Bhumi Amlaki in Sanskrit, or Kidanelli in Tamil. Phyllanthus amaris has been conventionally known to be used in liver diseases, in jaundice. Here, we are talking about Phyllanthus amaris because of its multivariate activity. One is it enhances the function of the liver. The role of liver has been already explained because pitta is related to liver. Similarly, Phyllanthus amaris is also a hypoglycemic agent which can enhance the functioning of the cells by absorbing the sugar from the blood. It can sensitize the hormone insulin, which main responsibility is to transfer the sugar from the blood vessel into the cell. We have endless list of ingredients from traditional knowledge and wisdom which can be used in diabetes. But however, an appropriate formulation, a combination of herbs which will take care of the different complications of diabetes is essential once a patient becomes diabetic. One thing is taking these food ingredients, supplements, before one gets into diabetes, or having an active physical activity, lifestyle, is something which can prevent diabetes. Once a patient gets diabetes, the appropriate combination of these herbs, which was listed earlier, like turmeric, Indian gooseberry, fenugreek, curry leaves, Phyllanthus amaris, and Picrus acrura, can take care of the complications of diabetes as well. The list is endless. We have Salacia oblonga, we have Gymnema sylvester, we have Syzygium cumini, we have many other herbs which have hypoglycemic activity. But the key is not just the plants which hypoglycemic activity which is important. It should be the herbs which have a powerful antioxidant activity, a liver productive activity, wherein you can ensure what is called as kaya kalpa, a longevity of life without any disease. The primary objective of a human being is to live a life which is free from illness, no complications, and that can be achieved only by a combination of a proper lifestyle, proper food ingredient, and also proper diet or medicine, which could be your diet. The medicine-based diet is something which is very important, which can help you prevent diabetes the very important role of the family cannot be ignored, because always we have seen if somebody in the family is a diabetic and needs to take a diabetic diet, the other members feel little uncomfortable. But a cooperation in the family is absolutely essential so that the person who is a diabetic gets his right food, and there is always a possibility that apart from one who is a diabetic in the family can also get the disease, because the lifestyle and the food habits are similar. Therefore, to prevent this, the entire family has to take into account of a diabetic person and take the food which is appropriate to them. What we have discussed so far is about the diabetes which occurs to the person, elderly person, or the type 2 diabetes. There are other types of diabetes called as type 1 diabetes, where the pancreas fails to do its duty, or gestational diabetes, a diabetes which occur to the pregnant women. The management and treatment of these diabetes are slightly different from what we do for type 2 diabetes, so that we need to take into account before we decide on any health plan. To sum up, the best way to prevent this disease is to have a healthy lifestyle, physical activity, which could be as simple as walking for 30 minutes to 45 minutes a day, a good dietary habit, which includes all the organic food, fruits and vegetables, minor millets, and also a stress-free life by practicing simple yoga and pranayama. Thank you for your time, and I definitely thank Mitra Chevi for this opportunity to create that awareness about this disease, diabetes, and to help the Stop Diabetes movement. Thank you all.